Hi guys, this is Karthik from Caapid Simplified. Welcome back. I think my quarantine beard is coming along the way. Today we're going to address a very important topic, a theme that not just comes in your LOR, in your SOP, but also, most importantly, in your behavioral interviews. Most interviews are structured behavioral. A few of them also have ethical and critical thinking questions. A few others, in very rare cases, have treatment planning questions. But that aside, most interviews are behavioral questions, and the one constant theme that they expect is this question around leadership skills. So, an admissions committee wants to know what kind of leadership skills have, you have demonstrated, and that you will bring to the practice eventually after you go out of graduation. Having said that, let's see what problem we struggle with. Most international dentists, and I generalize by saying this, but most international dentists have this preconceived notion that leadership is about this enigmatic person standing in front of a big crowd, leading them all with following them and making them follow him and so on. So they think of an example like Gandhi, they think of like Adolf Hitler, they think of somebody on a podium at a height who has this aura and people want to blindly listen and lead. That's because we have always associated leaders with political representatives, or leaders with people who have made some movement possible. But what they're asking you here is not about leaders. They're asking you about leadership. And this is the key difference. Leaders are people. Leadership is a skill, is an ability. So that's the first thing you'll have to get into your mind. You are not going to portray yourself as a leader. And in fact, portraying yourself as a leader in the sense of a hierarchy is actually counterproductive in being able to showcase yourself as somebody who's collaborative. They want somebody at dentist who can engage in the classroom, who can contribute to classroom discussions, who can interact with patients effectively, who can work with a flat organization, either as part of their DSO, as part of their own care team, or along with people who manage front office and back office work. They do not want you to be on top or below them. So if you were to assume that leaders are people who are this enigmatic person on top and who leads and everybody else follows, then you've got the picture wrong. That kind of says that you're not a collaborative person. You're not a person who embraces teamwork. So how do you bring across the point that you do embrace collaboration and also you have leadership skills? That's by repurposing or redefining what leadership means to you. Leadership could be a couple of things. It could be the ability to align diverse opinions, the ability to resolve conflict amongst people when that might arise, the ability to think big picture and yet think action, the ability to bring a bunch of people together and allocate, not delegate, allocate in different tasks amongst them. It might be the way leadership could be the way about ensuring that deadlines are kept, are met, deliverables are handed over, quality is assured, and you do this all as a team. So leadership is that ability. It's like think of yourself as this person who's sitting among the crowd within a hall, but then it's to your beat that everybody dances. You're not the one instructing like a choreographer would at the front of the dance hall. You're rather among all the people, but then you find this way to synchronize all of them, to direct their actions, to make them learn what they have to endure at record time, to connect them to the big picture of that their dance is about celebration or fitness or something like that. So you essentially are that small magnet orienting the rest, right? So if you can get this perspective in mind, you'll be able to much better draft your statement of purpose, much better talk to your recommenders about how they want to bring out your leadership skills, and way better answer your behavioral interview questions. A red flag here: do not go into your interview and say, I led a team of 5 people, I gave them work, I distributed this thing, I delegated and got everything back. I gave them performance appraisals and reviews. While that might be true, that clearly negates the point of the American idea of collaboration. You are in the place that you are because you've earned it, not because you can demand it. Just keep that in mind and you should be able to ace this question. Thank you guys. See you again.